Feel a stroke coming? Learn why and what to do before it's too late. Hey there, dear viewers. Welcome back to Elderly Wisdom Bird, where your health, safety, and peace of mind come first. If you're over 70 or caring for someone who is, you've probably heard about strokes, but maybe you're not sure what to do if you sense one coming. That's exactly what we're covering today. This isn't meant to scare you. It's to empower you. Because being prepared can mean the difference between life and a disability. So let's talk, like friends, about 10 warning signs, what they mean, and exactly what to do next. You'll walk away feeling more in control, more confident, and ready to act. Let's get started. 1. Sudden numbness or weakness on one side. One of the most common red flags of a stroke is sudden numbness or weakness, especially on half your face, arm, or leg. This happens because blood flow to part of the brain is blocked, causing that area to stop controlling sensation or movement. It can happen abruptly and progress quickly, sometimes leading to permanent damage, if not reversed fast. Meet Mrs. Jenkins, 82. One Tuesday morning, she reached for her tea and noticed her right arm had gone limp. She shrugged it off, she'd been stretching a bit, but soon her cheek felt strange when she brushed her teeth. She called her daughter, who urged her to call 911. By the time the paramedics arrived, the arm power was returning, and thanks to swift TPA clotbuster treatment, she walked out of rehab 3 days later. If you or someone experiences sudden limb or facial weakness, call 911 immediately. Every minute counts. And while waiting, keep the person calm, seated, and supported. Paramedics will prioritize a stroke protocol. 2. Slurred or strange speech. Another urgent sign is sudden trouble speaking, slurred words, or odd sentences. This happens when the area of the brain responsible for speech is affected. The person might talk oddly, repeat words, or be hard to understand. A major study at the Cleveland Clinic showed that 70% of stroke patients report facial droop and slurred speech, more than any other symptom. John, 78, was writing a grocery list, and suddenly the words sounded garbled. He tried to explain, but could only mumble fragmented phrases. His daughter recognized it from our video, called 911, and his hospitalized blood thinning began within the essential 3-hour window. Cognitive and speech therapy later restored his full clarity. If you notice speech changes, even minor, don't wait. Call for emergency help. Say your name and something simple.
A blockage may be happening in the brain's visual centers, or a clot may be affecting the eye vessels. This often indicates an ischemic stroke. Research in the Journal of Stroke and Cerebrovascular Diseases shows sudden visual changes occur in over 25% of stroke cases. Ethel, 81, was reading her Bible when the words blurred like watercolors. She closed her eyes and reopened them, still blurry. Then the right side faded black. She blinked, forced herself calm, and called 911. MRI confirmed a small clot. Treatment started, and within weeks, her sight was restored. If vision changes suddenly, blurry, black, double, don't guess. Call emergency services. Keep the person in a dim, comfortable setting to avoid stress and wait for professional help. 444. Sudden severe headache with no known cause. Not all headaches are dangerous, but a sudden severe headache, especially like a thunderclap, can be a signal of a stroke. It can indicate bleeding in the brain, hemorrhagic stroke, or a ruptured aneurysm. This is a medical emergency that can quickly become life-threatening. The World Stroke Organization notes that 27% of hemorrhagic stroke cases start with sudden severe headache. Harold, 79, sat watching the news when a brutal headache struck out of nowhere. Explosive pain, nausea, confusion. His wife recognized the tone from our education session. She called 911. His MRI revealed a small bleed, and surgeons intervened fast. Though slow, he's making a recovery today. Never dismiss a sudden, crushing headache, especially if accompanied by nausea, dizziness, or confusion. Call 911 immediately, and don't let the person take painkillers unless instructed. Keep them lying down and quiet while waiting. 5. Sudden dizziness, loss of balance, or coordination. If someone suddenly becomes dizzy, unsteady, or can't walk straight, it might be more than just vertigo. It could be a stroke. Stroke in the cerebellum, or brainstem, often causes coordination and balance issues, making everyday tasks impossible. A study in Stroke Journal found balance issues in 46% of cerebellar stroke cases in older adults. After gardening, 75-year-old Clara felt the world spin and nearly collapsed. She grabbed the fence, breathless and confused. A neighbor, armed with stroke awareness knowledge, suspected a stroke and called 911. She later learned clot-busting therapy saved her from more severe outcomes. At the first signs of dizziness plus weakness, call for help. Sit or lie down to prevent falling. Do not drive or walk. Wait for trained responders. 6. Confusion or sudden mental change. Sometimes strokes attack mental clarity, causing sudden confusion, memory loss, or disorientation. When the brain's processing areas are affected, simple questions become baffling. Research shows stroke-related delirium occurs in 20 to 30% of elderly patients.
George, 84, forgot where he was, thought it was 1950, and couldn't remember his wife's name. The family was alarmed, recognized the sign, and called 911. He received therapy and is slowly regaining clarity, but these moments were essential to catch in time. Don't brush off confusion as normal aging. Get help, stay with them, reassure them, and wait for professional assessment. 7. Sudden trouble walking or coordination. If a person suddenly cannot walk, stumbles, or has trouble coordinating simple movements, it's time to worry. This may mean stroke has hit areas of the brain controlling movement or motor skills, leading to paralysis or coordination loss. The American Stroke Association identifies sudden mobility issues in 60% of elderly stroke patients. Janet, 77, rose from a chair and couldn't stand straight. She froze in panic. Fortunately, her son watched, activated emergency services, and medical intervention later restored partial mobility. If someone can't walk suddenly or has trouble controlling limbs, call 911. Assist them to sit or lie down to prevent falls, and wait for medical help. 8. Sudden facial drooping. A droop on one side of the face, especially when smiling, is a classic stroke symptom. It indicates paralysis of facial muscles due to facial nerve impairment from brain injury. Named the FAST sign, facial drooping appears in over 80% of stroke cases and is an early diagnostic tool. Ellen, 81, was baking cookies when one corner of her mouth drooped. Her granddaughter, knowing about the FAST test, rushed her to the hospital. Rapid treatment stopped further damage and speech therapy helped complete recovery. Check. Ask them to smile. Does one side droop? If yes, it's an emergency. Call 911 immediately. 9. Sudden weak foot on one side, foot drop. Everyday tasks like stepping up or even walking become problematic in sudden foot drop due to stroke. Foot drop occurs when muscles in the leg are paralyzed, often due to a stroke damaging the nervous route. Neurology journals report foot drop in 30% of leg-affected stroke cases. Mr. Lee tripped over a rug. His foot seemingly had no strength. His daughter, alarmed, recognized the symptom from medical webinars. A hospital diagnosis confirmed stroke. Early physical therapy helped regain control. If one foot suddenly seems weak or drags, don't let them walk. Call emergency services. 10. Abrupt sensory disturbance. Tingling, burning, or pins and needles. Sometimes, the first sign of stroke is a strange feeling, tingling, numbness, or a pins and needles sensation in your limbs. This sensory disturbance arises from disrupted signals in the brain, or pressure on nerves when blood flow is blocked. A 2019 study in neurology found sensory changes present in 12% of early stroke victims and often overlooked.
Sarah, 72, awoke
to a strange numbness in her left foot and hand. Initially, she thought it was arthritis. A sudden speech falter made her husband alert, and they called 911. Diagnosis confirmed, treatment began within the golden window. Don't ignore sudden tingling, especially with other signs. Call for emergency help immediately. Keep them calm and don't let them drive. These 10 signs, when noticed early, can be lifesavers. If any single one occurs or multiple together, trust your instincts and call 911 right away. Share this video with anyone you love, family, friends, or yourself, because the best medicine is preparedness and speed. Let me know in the comments which sign surprised you most or has been helpful in your own experience. If this video helped you, please like, subscribe, and share it. Your action may save a life someday. Until next time, stay